and welcome to the fourth installment of our USV series. Today, we will be dispelling some of the prevalent myths surrounding diabetes and arm you with facts so that you may better manage the disease with confidence. I'm Eloni Bhatt, and joining me are three very distinguished endocrinologists who will sort out the facts from the fiction surrounding diabetes. So I'm very happy to welcome Dr. Nikhil Tandon. He's the professor and head of the Department of Endocrinology and Metabolism at the All India Institute of Medical Sciences, New Delhi. Welcome to economictimes.com, Doctor.
Thank you. Hello.
We have with us Dr. Rakesh Kumar Sahay. He's the professor of endocrinology at Osmania Medical College and Hospital. Good to have you here, Doctor.
Hello, thank you.
And finally, we have with us Dr. Sujoy Ghosh. He is the professor of endocrinology at IPGMER, Kolkata. It's a pleasure to have you here with us, Doctor.
Thank you so much, and very good day.
All right, Dr. Tandon, let's just address the prevalent misconception head on. Some believe that managing diabetes is a straightforward task. You just watch your sugar intake. But what are the daily challenges that individuals with diabetes truly face, and how do you think they can navigate this very multifaceted landscape?
I think it's a fair question, but a longish question to start with. Nonetheless, I think the first thing is that unlike acute disease, chronic diseases have to be handled over a lifetime. So you can't run them like a 100-meter sprint. You have to run them like marathons. You got to pace yourself out. Secondly, diseases like diabetes permeate every living, breathing moment of the day, and therefore they definitely constitute a challenge, and we should neither trivialize it and sort of pass that triviality to the patient saying that, why can't you fix these problems? They're so trivial. They're not. They're significant, because everything that you do, it's what you eat, when you eat, how much you eat, what is your extent of physical activity, external stressors, internal stressors, every single thing impacts on the overall management of diabetes. So it is a challenge. We need to be supportive. We need to be sensitive, and we need to provide as much information as possible to the treating physician, the patient themselves, and their caregivers in the support system.
All right. Okay. No, that's fair. Dr. Sahay, building on Dr. Tandon's insights, can you delve into the lifestyle modification debate? Does it indeed play a very pivotal role in diabetes management? And what are the kind of practical tips, that you can offer to guide individuals through the complexities of diabetes care?
Yeah, so as Dr. Tandon has just mentioned, there are several factors that are influencing the diabetes management, and one of the most important factors is probably the lifestyle of the individual, because that's the one which actually has been very important in the development of diabetes, and managing that effectively is going to have a very important role in effectively managing diabetes. So that is how I would say that lifestyle management is really important in diabetes management. And earlier days, we used to sort of give a lot of importance to that. We used to say that we used to spend at least a few months with lifestyle modification itself before starting on medical therapy. But today we think of starting, all the guidelines suggest starting medical therapy right on the day one along with the lifestyle changes, because we know that lifestyle changes have to be continued throughout the life of the individual. It's not just the first few months. And just to highlight the importance, what I would like to bring to light is the fact that most of the people who are now having diabetes, when they start having diabetes in the first few years, with effective lifestyle management, we even speak of remission of diabetes that is possible with very good lifestyle management. So that shows the importance of lifestyle management, and that is really very important in the management of diabetes, along with the entire gamut of things that need to be looked into. Lifestyle management nevertheless remains very important.
Right, so it is quite critical. Dr. Ghosh, talk to us about the correlation between diabetes and depression. Is it a myth that, what is the myth and what is the fact over here? Could you shed light on how these two often intertwine, and what are the coping strategies that you would recommend to address the mental health challenges associated with living with diabetes?
Thank you very much. My previous two speakers have already talked a lot about what happens in the life of an individual with diabetes and all that you're supposed to be doing to try and tackle it. That itself is pretty depressing, I guess. The patient has to think of lifestyle management, day-to-day challenges in the management of diabetes per se. So that itself, diabetes per se, will increase the risk of mental health issues, including anxiety and depression. And if you are depressed, that will worsen your diabetes because you're then less likely to adhere to lifestyle management. You're less likely to adhere to your medication. So it's a two-way pathway. So one worsening the other and often getting into a vicious cycle. Now, there's no one straightforward solution to this. Number one, if you're able to make the patient aware of the problems and yet help the patient to cope with the problems, adjust with the problems, empower the patient in terms of the various management issues and how to cope with, that probably will help at least allaying a little bit of the anxiety and depression. Of course, treatment of depression in terms of either drugs or non-pharmacological methods, including cognitive behavior therapy, a support from a clinical psychologist, all of that will actually help that bit as well. So if the patient is supported by the healthcare professionals as well as the family, because I think what Dr. Tandon was talking about was taking the caregivers into confidence as well. Because people tend to feel, okay, in my house, there's going to be a separate diet for me. There's nothing like that actually. So it's healthy living that's important in terms of whether you're talking about diet and exercise and helping to cope and understand about the problems. Of course, there's a problem, but it can be managed. It can be tackled, and that we have to be understanding. And of course, from our healthcare system, I think we doctors as well as other professionals need to have a lot of empathy in trying to help them to cope with what they're going through.
Right. We'll dive into this entire aspect, the food aspect of it, I think, a little later on in the discussion. But Dr. Tandon, coming to you, the economic burden of diabetes is a critical issue, right? Especially with the projected increase in the Indian diabetic population. Now, how can we effectively manage the financial responsibilities related to diabetes, considering there's a misconception that diabetes care is primarily about affordable medication?
So I think I need to put this slightly in context. And I think it's important that, a medium like yours can disseminate this piece of information that in 2022, the WHO actually has set targets for people with diabetes at a system level, right? And I'm just going to bring your economic issue in the context of that. And that was to increase the proportion of people who are diagnosed with diabetes. So actually your pool will increase further. Ensure that 80% of people with diabetes have their blood sugars well controlled, 80% of people with diabetes have their blood pressure well controlled, at least 60% of people above the age of 40 with diabetes are on cholesterol-lowering medications, and everybody with type 1 diabetes has access to affordable insulin and glucose measuring equipment. Now, if you tot up the numbers required to address those targets, which have been accepted by the member countries, and those targets are for 2030, you're very right, both at the system level and at an individual level, there is a significant economic burden. Now, the advantage which India provides to some extent, clearly, is we being the pharmacy of the world in many respects, a lot of branded and non-branded generic medications come much cheaper than what is seen elsewhere. So at least that alleviates or abrogates the cost to a certain extent. But remember, it's not just, as you rightly said, buying medicines. It could be injectables, which could not only be the cost of the injectable, but the devices used to inject, the monitoring equipment and the strips which are required for monitoring, the periodicity of the tests, the regularity of care to be provided by, other specialties, visits to the ophthalmologist, visits to the nephrologist, visit to the cardiologist, And God forbid, if there is a need for hospitalization, either for emergency or elective conditions, which happens much more often in people with diabetes, the cost gets inflated. And I think there have been a few economic studies done, and I think you bring a very valuable point here. Fortunately, with some of the new government schemes, at least a part of this is now getting taken care of better than it was in the years gone by.
All right. No, thanks very much, for providing that response, because I think people don't understand that, when we talk of diabetes, there are so many other factors also that need to be taken into consideration, that could put a pressure on, your financial condition. Digging a little bit deeper into the aspect of the economic burden, that could take a toll on several individuals with diabetes. Dr. Sahay, could you talk to us about this through the lens of, gender and prevailing socioeconomic disparities, especially from the India perspective?
Well, I think Dr. Tandon has just highlighted all the needs of a diabetic patient in terms of not only the medication, in terms of good monitoring facilities, in terms of visits to various specialists. So if you look at all these, I think there could be many instances when we see there that with the gender divide, there's a gender divide between the care available. Males probably are getting better care in some places, at least particularly for the complications, for hospitalizations. Probably we have more of them getting that type of care, and this sort of divide exists in at least in different parts of the country. It may be different, but I think there is certainly some divide in that, and this aspect also needs to be sort of looked into, and we need to address this issue so that we are able to provide a holistic care right from the beginning, so that the need for managing complications or hospitalization comes down, because diabetes is such a problem where if you are able to address it earlier on, you can prevent the complications, and the need for expenditure can come down significantly if diabetes managed early in the course of the disease.
All right. And is that done, would you say, for,
Well, I think
as well?
that is one aspect which Dr. Rannan was once again highlighting, that the one of the goals is to identify that 80% of people are aware about their diabetes.
Right.
Because what we see today is that based on the estimates which we have, population estimates, we expect that there should be about 100 million people with diabetes in our country today. But it's only half of them who are detected to have diabetes right now. Half of them are unaware about their disease, and they may end up with complications. These are the people who are likely to be at risk of complications. So it's very important that we screen early, identify the disease early, manage it more effectively earlier in the course of disease, rather than waiting for the complications to develop, and where the costs of management go up tremendously, maybe 10 times more than what would be the cost of managing the disease itself early in the course of the problem.
Right.
There again, lifestyle management, as I said, plays a very important role in the initial parts of the disease itself. That again has a very important role there.
All right. All right. Dr. Ghosh, let's explore that intricate relationship between diabetes and food, right? It's a myth, isn't it, that individuals with diabetes cannot enjoy diverse cultural food traditions? How would you say they can strike a balance between savoring varied foods and then adhering to a diabetes-friendly diet?
Right. I think during the previous question itself, as I was trying to emphasize, there's nothing called a diabetes related diet, because when we are talking about healthy lifestyle, whether it's diet or exercise patterns, it is essentially what everybody should be following. It's nothing extraordinary that someone who has the disease in the family should be having something else. And I do find it funny, even Bengalis nowadays having oats for breakfast, something that they've never wanted to have. They dislike it strongly, and yet they're taking it because they feel that's the healthy bit of the diet. It isn't. Traditional Indian diet has always been healthy. It's only in the last, I think, 10 to 50 years that people have changed their traditional forms of diet. So if we had stuck to the basics in terms of cutting down the oil intake, a balanced complex carbohydrate diet with enough protein and relatively less of fat, I think the diet would have been okay. It's because we have changed our diet we have more of a problem. We are having more of high calorie dense food stuff that we are eating, which is relatively easy to perhaps cook or get. That's what the problem is. And also remembering that everything in moderation in life is good, be it diet or otherwise. So if people follow those basic principles and stick to traditional ways of eating, I think I'm quite happy to let everybody eat what they have been eating in the past. And there's nothing called that you can't eat this or this is an absolute no. So maybe those food stuff or high calorie intake stuff will have to be moderated. So that's the basic principle.
All right. Doctor, sticking with this theme of myths, what are some of the common misconceptions or concerns that frequently arise during patient consultations? Could you share some insights into some of those?
Right. I think we could write an encyclopedia on that. I think there's a myth about everything when it comes to exercise, when it comes to food stuff, when it comes to what cures diabetes, and what leads to diabetes. You name it, you have it. People will walk on the grass barefoot thinking that it's going to cure diabetes. People are going to try and eat a lot of various kinds of alternative medicines and stuff, thinking that that's going to cure diabetes, or something is going to cure the blood pressure or dyslipidemia. So I think if you ask us, in all three of us, individual myths, I think we will be able to bust them rather than making a generalization.
Dr. Tandon, and these are now among my last questions to all of you. I want to talk about the impact of diabetes on personal relationships. Talk to us about the myth that diabetes is just a health concern. Obviously, previously in this conversation, we've talked about the link that diabetes has, with mental health, and all of that impacts your interpersonal relationships. How does diabetes influence relationships, and what guidance would you provide to those grappling with these challenges?
So health is not merely, as you rightly said, health is not, as a WHO definition went, is not merely the absence of physical infirmities, right? It's a combination. It's really physical, mental, spiritual well-being. And any chronic disorder, and I know this conversation is about diabetes, but any chronic illness can be sapping and very, very injurious to the quality of life of the individual, and by extension, the quality of life of their immediate circle of contacts, family members, care providers, etc. Now, more specifically, as we referred to diet, right? And Sujoy was talking about people saying, I can't eat something, there's a big tussle in the kitchen. So, I often end up asking the person, and who is the master or mistress of the kitchen in your house? Because that person eventually decides what is being cooked, right? And now, without going to the complex social dynamics of the Indian family, is often the eldest woman in that household, maybe the mother or the mother-in-law, who often takes charge, who may or may not understand to the same extent as individuals who are being afflicted with this problem as to what is required. So that becomes often a source of great friction and tension. Again, shifting to a slightly different form of diabetes, type 1 diabetes in children. A child always plays up to the heartstrings of an older person in the house and saying, I'm not being allowed to eat this. I'm not, my brother is eating an ice cream or eating a chocolate. I'm not. And that then becomes a sort of a weak point in the family. So there are multiple scenarios which can get triggered and create significant problems. The same thing will happen. And I know it shouldn't be said in 2024, but very often happens in the lives of a young woman who has diabetes, right? And acceptability to another family for marriage, especially if the decision is taken not merely at the couple's level, but at the extended family's level, has, in my experience, created a lot of turbulence in people's existence. And so it does. These are all very unpleasant examples, but they happen. And I think one must be cognizant of those and be prepared for those and manage those.
All right. Expand on that, Dr. Sahay. The role of family and community support in diabetes management. How much of that is a myth? And what sort of a role does it play in fostering a bias-free diabetes care mechanism?
Yeah, so as has been mentioned just now, that the immediate family or even the extended family has an important role in diabetes management, because the way the diet is followed, because
Yeah.
we may give the advice to the patient or the patient's spouse or immediate family members, but those people may not be the decision makers in the family, and in the kitchen, or these are issues that are going to be very important. And so it's very important to actually counsel the entire family. Generally, many times we have the entire family with available for counseling. We schedule some sessions every week, or every maybe once in a month. We ask the other family members also to join in for counseling, so that we are able to explain to them about the problem of diabetes, the lifestyle changes that are required, the changes in the diet, the physical activity aspects, and many other aspects are important to be highlighted, so that a diabetes can be effectively managed. Because diabetes is just not about medications, but it's about a change in their lifestyle, a healthy lifestyle, and also in the stresses all that are there to the person. Maybe the stress at the family level, at the at his job front, and all these issues are important, which have an important effect on the management of diabetes.
Right. All this, of course, impacts the way an individual will be able to manage diabetes, as you underlined, Doctor. Dr. Ghosh, this is now my question to you. The concept of self-management among individuals with diabetes. Are there any specific tools or resources that you would recommend that would enhance the patient's agency in managing their condition?
Right. I think, first of all, in hospital or in clinic, we should be trying to educate them as much as possible. That's the basic starting point. So having good diabetes educator in your clinic or hospital is the first bit, so that at least you can teach them the ABC. Then
Right.
at least the major institutes have takeaways in the form of books, booklets, patient information sheets. And if you're looking at things that are available commercially or non-commercially online, there are several apps. For example, you can check your blood glucose through the day with certain glucose measuring machines, and that itself will give you an idea of what's happening after you've eaten something or after you've exercised. So that would help the patient to understand what you actually told him, that this is what happens if you take this or if you do this. He will be able to self-teach himself in terms of what happens after change in exercise pattern or, say, for example, diet. Additionally, there are several apps that are available online itself. For example, for a kid with type 1 diabetes, there's something of a concept that we talk about predominantly, that's carbohydrate counting. So looking at the food and trying to figure out how much of carbohydrate is in that amount of food that individual is taking. And with that, he would match the amount of insulin in. And, take just a picture of the food in front of you, and through AI, you get an approximation of count of that food stuff and self-inject. So there are other things, like there are several commercial apps which will talk about simple guidance about the calorie content of the various Indian food stuff that you have. So if somebody is really conscious, because you're trying to look for food exchanges. If somebody's been told to have X amount of calories, you don't want the same food to be taken every day. You want to take X today, Y tomorrow, Z tomorrow. So you want to know how much of what to take. So there are several apps through which you can actually figure out more about the diet. Additionally, there are apps available for people who are on insulin, how to make dose adjustments. Because if you're having to go back to your healthcare professionals every month or so, it's not a great idea. So you teach them and then empower them, and also provide a backup support that, this is how you increase the morning dose or the evening dose, so that your blood glucose levels are within a particular range.
So, we were talking about myths and facts. So I'm going to put forth a couple of statements, and then, maybe you all can help me debunk them or, shed greater light on them. So, one of the statements is, my provider put me on insulin. This means I'm not doing a good job of managing my blood sugar. Is this a myth or fact? Dr. Tandon?
Okay. So remember, I mean, and we're not, so number one, for type 1 diabetes, it's 100%. You have to be on insulin. So we put that aside. There's no conversation there. In people with type 2 diabetes, putting somebody on insulin can happen because they've just had long-standing disease such that their own production of insulin is inadequate. And despite giving the best quantities of all available medications, you're not achieving glucose control, so it's required. Similarly, in the people with type 2 diabetes, there may be intercurrent illnesses or situations which may temporarily require insulin and then reversal back to oral medication. So it's not essential that it's being badly managed, but it could definitely be because of, the fact that somebody has been ill for long, or there's an acute overlying condition which has necessitated the use of it. It can also be because you've done a terrible job, but it's not invariably because of that.
Okay, all right. Dr. Sahay, you next. I can stop taking diabetes medicines once my blood sugar is under control.
Yeah, so this is absolutely a myth because we have to highlight this the fact that diabetes is a disease which is a chronic disease which is going to be there with the person, and this is because of inadequate production of insulin based on the requirement of the individual. And there are situations where the person in the initial phase of diabetes can bring down his requirement for insulin by maybe optimizing his weight, optimizing the lifestyle, and may not require medications for some time. But it's not a fact that the medication will not be required for always. This person may also require whenever the blood sugar starts going up, and for all practical purposes we need to understand that the diabetes is going to be there, and that has to be adequately monitored and controlled, so as to prevent the complications.
All right. Okay, Dr. Ghosh, you next. I have borderline diabetes, so I don't need to worry.
Right. I think one of the things that we need to understand is the complications of diabetes depends predominantly how you have initially treated your disease. So if the initial period of disease you've not treated very well, then once complications set in, however good you try to treat the individual, it's going to be more of a waste. So in the past, we were taught that the first decade after diagnosis is what matters. What we understand now is perhaps even the first year matters even more. So so hit hard, hit early. I think two things were mentioned in the conversation today. Number one, Dr. Sahay mentioned that unlike in the past when people said, okay, let's give lifestyle a chance and then we start medication, we start bang on from day one with lifestyle as well as medication. And what Dr. Tandon said, that about 50% of people know that they have diabetes, right? So the ones who know, the disease might have existed for quite some time even before that. So you don't know what's happened. Even what we are saying is starting early might not be that early. So there's no point in saying, I've got a touch of diabetes, I've got mild diabetes. There's nothing called mild about it. And particularly the cardiac complications start even before the diagnosis.
Right. Okay. All right, Dr. Tandon, I think this is my favorite one. I have diabetes, so I can never eat sweets.
I think this has to be answered with some care because, people pick up the message which is convenient for them and take it. I think what Dr. Ghosh mentioned very early was that you need to be sensible about what you're eating, right? It's all about moderation, not necessarily martyrdom. So there will be occasions where you feel that you may want to eat something sweet. Fine. Now the question is how much and how often versus somebody who does not have diabetes. So again, you need to be sensible. You need to monitor and see the response. If you've actually eaten something which is outside the realms of what you've been prescribed, and you still seem to be getting a reasonable glucose level, then that expands the sort of spectrum of things which you can take. So it's not like So remember, for chronic disease, to say that it's a 0-1 rule, it's never and always, except for tobacco, which is never. I think for most other things, there would be occasions and opportunities when partaking a small amount may not be considered to be as big a, an act of criminal negligence as it was when we were being taught about diabetes as younger people. So I've tried to thread it around, but I think the message has to be, you need to see the impact of whatever you eat, right? And if it's keeping things in even keel, go ahead.
Okay. All right. Dr. Sahay, diabetes only affects people with obesity.
Yeah, so this is a big myth which has to be understood, because particularly in our country, what we see is that while the world over we may say that diabetes is a disease seen only in obese people, but in our country what we see is that diabetes affects even the lean people, and particularly we see that this is also occurring at a younger age also as compared to the Western population. We see that we develop diabetes at a younger age, at lesser body weights, and therefore we need to not keep this idea that diabetes doesn't occur in people who are lean and thin. It is important that they also should test for diabetes. They should not feel that they are immune from diabetes. They should be regularly checking and identifying diabetes early, because as we just mentioned during the course of the program, is that diabetes often gets missed out. We don't identify it early, and the very golden opportunity that we have in the initial years to control diabetes well and prevent complications is lost out by the time diabetes is diagnosed. So therefore we shouldn't have this myth that diabetes happens only in obese individuals. We should all check even in people who are not obese.
All right. Dr. Ghosh, last one to you. Some natural products and alternate therapies will cure my diabetes.
I think when you were asking me about, what's the commonest thing that people come up and ask, I was very, very tempted to make this statement. You will see the newspapers flooded with advertisements of various kinds, and people claiming quick cure to diabetes. And I think we've got to address this question very, very carefully and rationally. In most of the cases, I'm not saying all of the cases, in most of the cases, these should not be believed, because this is based on something that's not necessarily scientifically proven. But you've got to understand that there might be some kind of, maybe some tree-based, plant-based stuff which might have potential to do something good, but that actually needs to be checked in a clinical trial.
Right.
And then that particular dosing and whatever needs to be checked. The challenge and the problem is, in India, people have started believing that whatever is so-called Ayurvedic is necessarily safe. It isn't. And a lot of these stuff have heavy metal. We've seen people come back with renal failures. We've seen people having liver failures and a lot of other complications. Anything that has an effect will have a side effect. So that's the first basic premise. So I would request people to avoid untested, uncertified
therapies
products which have not undergone rigorous clinical trials, because it's only after a product undergoes rigorous clinical trials that we are aware of both the good and the bad of it. So there's a lot of products there which we don't know whether they're good and we don't know whether they are bad.
To add to that, I would just say unlabeled also, because many of these substances don't have any label at all, and people believe that more than a medication which has been tested, tried, and has all the available ingredients written out there.
All right. No, very important. Ensure that you go through your doctor, and don't try products, especially those which are not labeled. Thank you very much, Dr. Nikhil Tandon, Dr. Rakesh Kumar Sahay, and Dr. Sujoy Ghosh for the many insights and for the pragmatic advice. I hope that this conversation has helped demystify diabetes, and that it has helped shatter stereotypes and myths and brought the facts into sharp focus, so all those who are watching can manage diabetes with greater confidence. Thank you to the audience for watching. You can catch all the webinars and which are linked to diabetes on our website, economictimes.com. Thanks so much, everyone, for joining us.
Thank you and bye-bye.
Thank you.
Thank you.